Thank you, Dr. Reshma, and respected chairperson, Sir Dr. Agrikar, sir. Uh, Sorry for the change in the session, and thank you, Mudit, for accommodating me. And I have a flight to catch at 1:35. So this is a Tech It Up session, and Dr. Manoj Chawla, Dr. Jyoti Dev, they are all the technology man of India, and Dr. Jyoti Dev just talked about the insulin pumps and the AIDs. As rightly pointed out by the chairpersons, now we have everything in our hand, or for every need, whatever we want to do, whether it is your travel plan, your education, and your banking, and every need, even for the communication, you have everything at disposal in the form of the mobile phones. So when I say my tablet, my clinic, so it is not just the tablet, it is the digitalization of your clinic, which is very, very important. So tablet is a symbol for the digitalization of a diabetes clinic. And I think going forward, digitalization of a diabetes clinic is very, very important because rising prevalence of diabetes, and we have shortage of the healthcare professionals all across the world, and digital diabetes technologies like telehealth can expand access, reduce burden, and improve efficiency. And Dr. Jyoti Dev, though presented on the AID, but he is one of the right person to talk about the telehealth because he presented his data at the ADA itself. So I will be talking about the opportunities, what can be the obstacles, and the requisites for advancing digital clinics. So why I say that digital diabetes clinics? Because traditional models, they struggle to meet the growing demand for the diabetes care worldwide. There is a therapeutic inertia and the lack of timely interventions leading to the poor outcomes. So when you are not digitalizing your prescriptions, keep the follow up of your patient is very, very difficult because you don't know what was the reports last time, what was the HbA1c last time. Patient may not be coming with the document, and it is very difficult for a clinician to plan the follow, because here you need long term monitoring, you want to assess for the complications as well. So if model improves, a digital model improves reach, sustainability, and the patient centered care. And another important thing is that if you are using digital tools, probably you can also do the benchmarking of your clinical practice. You can always see that how many of your patients are actually achieving good diabetes control, how many of your patients are above, are not having a good control of the HbA1c. So what can be done in these patients? How you can change your practice to improve the outcome? So digitalization is very, very important in this aspects. Now we are having connected devices, so patient can share their physical activity data with you. They can share their glucose data with you through the connected glucometers. They can also share their CGM reports with you. And now with the AIDs, all the data is coming to you. So how are you going to analyze that data without the digitalization? So this is also not just advancement, but this is also the need of the hour. And the real-time data enables immediate feedback and therapeutic adjustment, though many of you may not agree that it may add to the burden of the clinic, but this is a reality globally. And the population level databases, again, they allow risk stratification and evidence-based care. So I would just like to highlight, many of you participated in the 10 by 10 hypertension challenge. Dr. Anuj Maheshwari presented the data yesterday. Within 10 days, 15 days, we were able to screen more than 2 lakh people all across the India for the hypertension. And I was leading this campaign as a national coordinator. And the data identifies that even in those patients, almost 40% of the patients, they were not even knowing that they have hypertension. And those who were having hypertension, they were not well controlled. So this could be possible only because of the digitalization of the data. Otherwise, once you don't look at the data, these patients were not something we went to the community. These were the regular patients who were coming to our clinic. And once we digitalized everything, we were able to go back and look into the data. Also, if we talk about the benefits for the healthcare system, so it can reduce preventable hospitalization, it can reduce the cost of the emergency hospital visits. So digitalization is a game changer. You may use a tablet, you may use a laptop, sometimes you may use a mobile phone also to the consultations. I often find Dr. Sunil Gupta, I often find Dr. Manoj Chawla, Purvi Chawla doing consultation digitally most of the time when they are traveling. So the clinic is at your disposal. From paper to pixels, now the clinic workflow evolution has improved from the paper to the digital present. I will not go into the details and how digital clinic can enhance clinical efficiency, because you save time in the administrative actions. You also have access to the information all the time, and there is a team communication. So you can build team around that. So different members of the team are playing different roles, and they are all having access to the data, and they can take decisions. And this eases your burden, and you can focus on the more clinical work. Empowering the patient through the technology is also important. So if you are using technology, your patients are also using technology. So whether it is the health tracking, whether it is the management of the medications, it is the personalized education. So many of you can send reminders to your patient, can send educational videos to your patients, can do sessions, online sessions. For example, I know Dr. Makkar does one Facebook live every Tuesday for his patients. So this is one of the digitalization, because if you are a digital savvy doctor, only your patients will be able to use those technology and connect with you. So this also gives you an opportunity to connect with your patients outside the clinic. So my clinic, my patient portal, connected care, and anywhere. So these are the different things which may be available. And I will not go into this story, but one thing is important, that a patient who is more engaged is always going to have better outcome. So a patient who you will immediately all the senior physicians, they know this fact, that we know somewhere that this patient is actually is having a good rapport with us and is trying to listen to what we are saying. And obviously, we will find that such patients achieves better in terms of glycemic control, prevention of complications. But those who are not on board, most of the time it is most of the time they will end up with the complications. So engaged patients have better outcome. This is important. Now the continuous glucose monitoring is now we have multiple CGM options available in India, and the integration of these CGM devices with your EMR system or the EHR system is very, very important. So I will not go into the detail that how CGM is benefit, but the analysis of the CGM record. For example, we have LibreView for the Abbott CGM sensor. So if you are using different sensors, probably you would like to have a dashboard where you can see. We have various connected glucometers, like there is a My Sugar applications from the Roche. You have a B2 application. So these are the different brands which I am naming. So you can have access to all the glucose readings of your patient on your dashboard. What are the barriers, accessibility and usability? I think on this we need to work, because most of the time some of us are using older systems, and we have so much of the data on the older system that this comes as a barrier, that how do we move to a better or the advancing system, because we don't want to lose on to that data. And the newer systems, they don't have any mechanism to import entire data in the same format in which you were using it. So these are the challenges that I think Dr. Modit, who is a technology expert, can identify some of these solutions. Tech literacy support is again very, very important, and the offline functionality and the multilingual support. So sometimes these glitches may happen because of your entire system is on cloud, entire system is connected on the internet. The moment you don't have access to the internet, everything is lost. So sometimes it happens to in our clinical practice, because even for few minutes, if there is a shutdown of the internet or the server of the EHR or the EMR is not working, you will immediately be lost, because you don't have any information, and you're not able to retrieve any data. So I think we need to work on those solutions where we are having the access to our EMR and the EHR even in the offline mode. And probably this may be very, very important into the resource limited settings, or even the rural areas where sometime, or the remote areas where the internet access may not be that good. So this is about the accessibility and different innovations. For example, now we have decision support and diagnostic tools which are available. So just to inform you now, globally, we are moving from the standard of care to the standard of practice. And what I mean by saying standard of practice is that we know that what is to be done in people with diabetes. So we have standard of care from ADA, we have guidelines from the RSSDI, we have guidelines from the IDF. But nobody tells us that how do we apply those guidelines in the clinics, how do we incorporate into our workflow so that ultimately the standard of the practice improves. So here the decision support system and the decision support systems, they are going to play a very, very important role. And very soon the IDF School of Diabetes is coming with a decision support system which is going to be launched globally in this. So all of you will be having access to this system which you will be able to use in your clinics. Remote consultations and telemedicine, we have seen the power of that remote consultations and telemedicines during the COVID-19 pandemic. And during this pandemic, we found that the telemedicine growth was amazing, up to 400%. Rural access improved, and the average waiting time of the telemedicine consultation is very, very less. Also now, with the advent of the wearable devices, I'm working on some of the trials with the non-invasive glucose monitoring, even the BP monitoring with the smartwatch. So all of this data can sometime be pulled in near future. You will be able to pull all this data into your digital clinic. So I will not go into the details. So the future of the diabetes clinic, there are multiple technologies which are emerging. and integration with the smart clinic infrastructure is something which is very, very required. So you have a tablet here means digital component, you have a patient navigation system, you have a monitoring equipment, you have an environment which is ambient, and you can also do the inventory monitoring. So many of us have pharmacies in our clinic, and how do we monitor that? Which inventory monitoring of the inventory is again very, very important. So this can be done with the digitalization of the clinic. Sustainability and the cost saving: in the long run, you will be saving on the papers, you will be saving on the storage space. In the Mumbai, the space is very, very expensive. In Delhi, it is not that expensive, but still, the Mumbai is one of the most expensive cities. So you would like to save some space also, and the cost of administration also goes down because some of these things can also be managed remotely as well. So overall savings are very good if you are going for a model. And it is important to onboard everyone. So educating yourself alone is not going to help. So you have to educate your team alone. So you need to improve the diabetes care professionalism of your team as well. So this will come with the education, and we are going to support education in multiple ways. So tomorrow's clinic is today. Barrier and challenges I have already identified. Solutions are that we want to have better internet connections. We want to have offline models for the critical applications. We want to have backup of our records and optimized applications for the low bandwidth areas also. It is important. This is, I think all of you must pay attention to this, because the benchmarking is very, very important. We use different EMR and the EHRs, but the benchmarking is not happening. So how many of you actually go back and analyze that out of your 1,000 patients, what was the average A1C? What was the average control of the blood pressure? How many of them were screened for the retinopathy? How many of them were screened for the urine ACR? So these are different things which benchmarking can help and identify. So this is a call to action that embrace digital revolution in your clinic. And this is a summary that how the tablets or the digitalization can transform clinic. I will fall short of saying that the AI will replace humans, so that is not going to happen. But AI is definitely going to help us in designing better decision support systems, better communication systems. And so summary and the vision of this talk is that digital diabetes clinic expands access, improve outcomes, and reduce cost. Telehealth has proven benefit and essential and transformative for the care delivery. Barriers are there, such as interoperability and the changing of the EMR and the EHR. Reimbursement, because sometimes telemedicine reimbursement is not allowed for the telemedicine. The vision is clear that one device, one digital clinic, and better care for all people with diabetes. With this, I would like to thank everyone and acknowledge Dr. Alok Modi for helping me with the slides, because I was busy with my election campaign. Thank you.